name is Catherine Price and I'm a physical therapist. Today I'm going to go through an exercise routine which is the Egoscue Method for thoracic back pain. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. These are simple yet effective exercises for individuals who have chronic back pain and especially mid-back pain. So this is going to be the area where the ribs attach to the spine. So anywhere along the spine, the thoracic spine, there's 12 vertebrae, and those ribs are going to attach to those vertebrae. In that area, if you are having back pain, these exercises may be of benefit to you. So before I begin, I'm going to speak a word of life from Psalms 121, 1 through 2. I lift up my eyes to the mountains. Where does my help come from? My help comes from the Lord, the maker of heaven and earth. Amen. So to begin, the tools that I'm going to have, I'm going to grab a timer. So I do want to have a timer. I'm going to use just a regular chair. If you have an ottoman or a rest or stool, that's going to be of help for one of our exercises. And then you want to have a 4 to 6 inch block and 2 of those blocks, and we'll use those. So again, this is the Egoscue Method for thoracic back pain, and this is going to be a method to help align the body and address the posture. So the idea is that if you are in alignment and good posture, or you're in posture that reduces the strain and stress on the body, then you can reduce that chronic pain. So let us begin and follow along with me, and we'll go through this. This is going to be an exercise menu with 6 exercises. And we'll begin with the static back. I call this the astronaut position. So you just want to grab your chair. You want to bring your legs up over the chair and lie onto your back with your buttocks close to the chair so that your hip is at a 90-degree angle and your knee is at a 90-degree angle. I'm going to set my timer for 5 minutes. It's going to seem like a long time, but we're going to focus on diaphragmatic breathing as we do this. So I've started my timer. The position that I want to be in, again, you are going to bend your knees to 90 degrees and your hips at 90 degrees. So scoot your butt up as close as you need to be to get that 90-degree angle. This gives natural traction to the back. It allows the hip flexor to relax, and it should feel good to the low back in this position. Now, as you're lying here, if you start with an arched back, you want the back to relax. You want to keep your abdominals relaxed. Everything just sinks down to the floor. So you're working on getting that area to just let go and relax and approach the floor. With your hands, you want the palms up towards the ceiling. So if you start by your body, you want to keep those palms up and then bring them out 45 degrees. So then I want to hold my arms 45 degrees from my body, relax my back, and just rest in this position. Now you want to do diaphragmatic breathing. So what is that? That's breathing with the diaphragm. The diaphragm is that big dome muscle underneath the bottom of the rib cage. So to activate the diaphragm, when you pull your air in, you want to expand the ribs, and you can call this also a rib anchor. You want to anchor those ribs against the floor as your ribs expand with the inhalation. So I'm going to breathe in and pushing my ribs apart, and then I'm going to exhale with a small hold. So I'm going to purse lip breathe. Breathing in. The belly should rise, but I don't want to, I'm not arching my back. I'm just allowing the ribs to expand, and the ribs are gonna press down into the floor, and then exhaling. Inhaling. Exhaling. keep breathing. I'm going to just talk to you a little bit. So in this position, your hip flexor is completely relaxed. Your hip flexor is attached to the diaphragm. And so when you are then taking those breaths, you're allowing the diaphragm to move further because you're not having that hip flexor pull on the diaphragm. So you really want to use this position to your advantage and really get that nice diaphragmatic breathing. So pulling the air in with the lower part of the ribs, expanding the ribs without the back arching. And then exhaling. Anchoring the rib down to the floor. And exhaling. And when you keep a small hole with the exhale, it helps hold the alveoli open in the lungs, which just allows the oxygen to stay in the body. So you want to oxygenate the body. That's going to help with all the soft tissue. 10 seconds. So that's going to complete the 5 minutes of the static back. So holding that position. After this, we're going to do reverse presses. So to do that, I'm going to then take my elbows. I'm going to bend my elbows at 90 degrees and line my elbow in line with my shoulder. So I'm going to have elbows down by your side coming out 90 degrees. So elbows in line with the shoulder and then the elbows bent 90 degrees. My fingertips pointing up towards the ceiling. Then I'm going to just curl them to make a soft grip. I want to squeeze the area between my shoulder blade and press my elbows to the floor. When I do this, I don't want my back to arch. You want to keep the back relaxed, so don't arch the back. Keep the back contacted with the floor the whole time. We're going to do 3 sets of 15. So do these with me. Squeeze your shoulder blades together, pushing down, and then relax. So here we go. 1, 1,000, relax. Press 2. Relax. Press 3. Relax. Press 4. Relax. Press 5. Relax. Press 6. Relax. Press 7. Relax. Press 8. Relax. Press 9. Relax, press 10, relax, press 11, relax, press 12, relax, press 13, relax, press 14, relax, press 15, relax. Diaphragmatic breath, deep breath in. All the way out. Same thing. Relax. Make a nice relaxed fist. Push the elbows back down. 1, 1,000. Relax. 2, 1,000. Relax. 3, 1,000. Relax. 4, 1,000. Relax. 5, 1,000. Relax. Press 6. Relax. Press 7. Relax. Press 8. Relax. Press 9. Relax. 10. Relax. 11. Relax. 12. Relax. 13. Relax. 14, 1,000. Relax. And 15, 1,000. Relax. Diaphragmatic breath, breathing in, all the way out. Our last set, loose fist, squeeze between the shoulder blades, pressing back with 1, relax, press, 2, relax, don't rush them, press, 3, relax, press, 4, relax, press, 5, relax, press, 6, relax, press, 7, relax, press, 8, relax, 9, relax, 10, relax, 11, relax, 12, relax, 13, relax, 14, relax, last one, 15, and relax. And breath in, and all the way out. That completes 3 sets of 15 of the reverse presses. Then we're going to do pullovers. So you take your arms, you're going to collapse your hands in front of you, straight up towards the ceiling. Elbows stay straight. I'm going to bring my arms overhead as far as I can. If you've got thoracic pain and your spine is not stacked, this can be a very difficult exercise because of the restriction in the shoulders. So you want to bring it back as far as you can and then bring back up towards the ceiling. So we're going to do 3 sets of 15 of these. This is number 2. And coming back up and over, 3, back up, 4, back up. Keep your back against the floor when you do this. 5, back up, 6, 7, 8, 9, 10, 11, 12, 13, 14, last one, 15, and diaphragmatic breath. Second set, clasping your hands up and over. 1, back stays on the floor. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, last one, 15, and taking a deep breath in, all the way out. Last set, hands clasped, back stays on the floor. 1, 2, don't rush these. 3, 4, 5, 7, 8, 9, 10, 11, 12, 13, 14, last one, and 15. And that completes the pullovers. So I'm going to come out of this position, and next I'm going to grab my 2 blocks. So I'm going to set my chair aside. And this is going to be a floor block. So I am going to take my 2 blocks and I'm going to place them right in front of me. And I want to lie onto my stomach. I'm going to rest my forehead on the mat. If you need a towel roll so that you can have more space to breathe, that's fine. So I'm going to have my arms in 3 different positions. The first thing though, pay attention to your feet. You want to internally rotate your hips so your heels are going to be faced away from the body and the toes are going to be touching. So you're just rotating your legs so your hip is internally rotated, or you're letting those heels fall out to the side as opposed to the foot going out this way. So I'm going to turn my toes in, pigeon toe. So you want to be in a pigeon toe position. So I want to set my timer. Each position we're going to hold for 1 minute. So follow along with me. Let's set the timer for 1 minute. And I'm going to, before I start the timer, you want to take your thumbs. You want to have a loose fist, or you want to just turn the thumbs so they're facing up towards the ceiling. You want to have the arms straight overhead. So this is going to be 12 o'clock. We're going to hold this 12 o'clock position. The hips are internally rotated, so pigeon-toed. You want to hold here for 1 minute. Then we're going to go 10 o'clock and 2 o'clock and hold here for 1 minute. And then 3 and 9 o'clock and hold here for 1 minute. And our arms resting on the blocks though. So let us begin with, let us begin 1 minute. And thumbs are facing up, and here in this position I'm just going to hold, and I want to keep my body relaxed and take nice breaths in and out using that diaphragm. Deep breath in. And I want to keep my thumbs up using the shoulder. I don't want to be forcing through the elbow. I want to use my shoulder to hold the thumbs up, getting that nice rotation in the shoulder. Holding this position. And we're hold for a whole minute. We then want to take the blocks and go to 10 and 2 o'clock. So out to the side. And let us begin. Again, you're going to use the shoulders to rotate the thumbs up, keeping a nice loose fist and thumbs facing up. Holding those shoulders into that rotation, keeping your feet in pigeon toe and taking a deep breath in. all the way out. Keeping those thumbs up, those shoulders rotated. 2, 1. Then we're going to bring those arms out to the side. And this is going to be at 3 o'clock, 9 o'clock. So you want them straight out to the side. Starting your timer for 1 minute. Same thing, thumbs are going to be up and resting here. Keep your back relaxed, pigeon-toed, and taking a breath in, all the way out. If you feel the shoulders start to want to rotate in, use the shoulders, hold those thumbs up towards the ceiling. And keep taking breaths in, relax, and breathing in. And that completes the floor block. The next exercise on the menu is going to be static extension. So if you have an ottoman would work great. I'm going to use this box. So what I want to do is I'm going to first, and you want to make sure that you're safe doing this, whatever you choose to use. So I'm going to kneel on the box and then walk my hands down. I then want to bring my hips forward slightly in front of my knees. So my hips are going to go in front of my knees, and then when I look down, or when I should see that my hands are directly under my shoulder, and then I want to gently tilt my butt up. So I'm just going to gently arch my back. You don't want to engage so that it's painful, but you want to have a gentle, nice lumbar curve. So I'm going to gently tilt my butt and then just pressing or holding this position and relaxing my neck and head. So I'm going to relax this position and I'm going to have a curve in my back. So I am going to set my timer and I'm going to hold this position for 2 minutes. You can hold this position anywhere from 1 to 2 minutes. If you have some weakness in your arms, I've set my timer, then you'll have to build up the strength to hold this position. So I want to keep my neck relaxed, my hands are underneath my shoulder, and my hips are slightly forward in front of my knees. And I'm just going to let my low back sink with my buttocks tilted towards the ceiling. And I'm just going to hold this. This is just going to help to align the spine. And you want to bring that body in good alignment. And just continue to hold. Same thing, I'm just going to work on taking nice deep breaths in. So you're at a minute, and that may be sufficient for you at this point. And you can continue to hold if you feel like you can, or you can come out of the position and build up to this. So I've got about 30 seconds left. Hands stay underneath the shoulders, and you want to relax the head and neck. And taking your breath in, all the way out. My buttocks is pointed towards the ceiling, taking a breath in, and all the way out. And that should be 3, 2, 1. Okay. So that is going to be the static extension. I'm going to come out of that position. And the last exercise on the menu for thoracic back pain is going to be a squat. But to do the squat, it's going to be in a very specific manner. So I'm going to hold on. You can hold on to a doorknob or a rail. You want to keep your toes facing forward. You don't want them out to the side or turned in. You want your toes facing straight ahead. And then when you squat, you're going to come down so that your thighs are parallel to the floor as best you can. And you want to keep a straight back as you can get. So you don't want to be leaning forward and you don't want to be overarching your back, but you do want to keep that back in alignment, and you're going to have your nice lordotic curve, and we'll hold that. Now this can be held from 1 to 2 minutes. So I'm going to start my timer. If you feel like you are tired or that 1 minute is what you can hold today, then stop at a minute and you can build up to 2 minutes. So we're just going to hold this position. You should feel working in your legs, and you're going to just keep your back straight as you can and just hold right here. Taking nice deep breaths in, all the way out. Deep breath in and out, and just hold this position. Toes are facing forward and holding. So again, this is the Egoscue method for thoracic back pain. There are 6 exercises in this menu. They are simple yet effective for chronic mid-back pain. So this is the area that's going to be where your ribs are attached, so your 12 thoracic vertebrae. So that's going to be between your neck and your low back. If you've got pain in that back region, these are great postural exercises to do, and I would do them on a daily basis if I had back pain in that area. And it will not be a bad idea to check with or go to a physical therapist for an evaluation to see if this is a good routine for you to be doing. And we are almost done. Let's see what our timer says. 15 seconds. And that will be the completion of 2 minutes of your squat. So keep holding. Deep breath in. All the way out. That is the 2 minutes. And that completes the routine, the Egoscue method for thoracic back pain. Have a blessed day. Thank you.